The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hi, everybody. Dr. Tom Roselle here. Welcome to Asia's Health with yours truly. Got another great program for you today. And, we're all leading into something that we're doing this coming Wednesday evening, the 19th. 19th of February is already here. So what's that? It's called, our in-house continuing education program, and it's going to be body signs and signals and things that your body's telling you that you're ignoring, and that could lead to something extremely serious like a heart attack, or maybe you're brewing cancers or things of that nature. And I want to touch upon some signs and symptoms that your body's trying to talk about, meaning is trying to get your attention, but you're ignoring it. And that's not okay, because it could cost you, and it could cost you far more than what you really want to pay. So what am I saying to you? Look, here's the deal. We get obtuse. We don't pay attention. We become our own worst enemies in many cases. And that inability to interpret what our body's trying to tell us can cost us our lives in many situations. Minimally, it can cause us impairment. It can take our energy away. We don't feel good. We can end up with dementia. We can end up with all kinds of lousy situations that we don't even want to be here anymore. And then that all by itself begins to downhill as rapidly as it possibly can. Now, let's get into it just a little bit, because I really want you to have this information. I want you to be able to say, I got something not only that I have to pay attention to, but I have to act upon and be able to ask the right questions of the people that are supposedly there to help me. And that's the other piece. And that's what you're going to learn on the 19th. You're going to learn that some of these signs and signals you can resolve, you can take care of, you can change, but you got to know what they are, and you have to know what they're talking about. Over the last several weeks, we talked about things like your nails, right? If you don't have these little luna, these little moons, these half moons at the bottom of your nail beds, nice and bright and full, that tells you your immune system's not working. We talked about a long line vertical in your ear. That's called a Frank line, and that could be cardiovascular problems. We talked about, cramping and things of that nature. We're going to touch upon that, but I want to give you some very specific things that you need to be aware of. And if you're aware of it, not only can it save the quality of the years going by, but it also can save your life and the longevity of, we all want to be here for a period of time. Okay, so let's kind of touch on it just a little bit. And then, we'll kind of tie a lot of things together and prompt you to join us on the 19th. Be there with us. Dr. Qinglong Zhang, one of the most amazing traditional Chinese medical physicians and chiropractors who works at the Roselle Center. We're going to go back and forth. And this man is really top shelf. He knows his stuff. He has the capacity, and he's effective. And that's the most important thing. So we're going to give the Eastern and Western look. We're going to show you what your body's doing. But more importantly, we're going to give you tools that you can help yourself and your family. I have a really bad habit. I'll be at a restaurant, and a waiter comes up and says whatever they're going to say to me relative to dinner. And I'm looking at them. I can't help myself. I'm looking at their eyes, their earlobes, their skin texture. I look at their hands when they put something on the table. And I watch their gait. I watch the way they move away. And I listen to the tone of their voice. It's automatic for me. But I want to give you tools so they become automatic for you, to start with yourself so you can have an amazing life. So let's get into it just a little bit. I think you're going to really be able to use these things. So what are these signs and symptoms that your body's trying to tell you about? How about, unexpected weight loss? What could that be? What could happen? A lot of people say, yeah, I wish that happened to me. Well, guess what? Sometimes it's not okay that you're eating everything that you normally eat, and you have the same lifestyle, and all of a sudden the body weight is starting to drop off. It could be a signal that you're developing disease processes sometimes with your thyroid. It could be an autoimmune type of situation where your body's going to start breaking down because the levels of inflammatory reactions are going through the ceiling and so forth. It could be cancer. It could be a tissue depletion condition, but you can't ignore it. You can, oh my gosh, I'm finally starting to lose weight. Not necessarily so if you haven't changed something. It just doesn't happen automatically. How about if you're always hot and not just warm in the environment, but you got a fever? Did you get it measured? So that increased fever could be you're fighting an infection. In today's world, particularly a viral infection. They're all around us. They always have been. It's nothing new. COVID didn't spark it and say, now we have all these viruses. You had it beforehand. So we want to make sure that you understand that it's a sign that says there's something that your body has to deal with. And now it's time to get a blood test done. And you look at the white blood cell count. You look at the different types of white blood cells, the neutrophils and the lymphocytes and the basophils, the eosinophils, and so forth. And you put them all together, and that's identifying thing. Then you may need to do other subfractions, but you have to act on it, because if you don't act on it, you let that continue, something is causing. That's just part of it. How about shortness of breath? How many of you walk up the stairs and say, "Oh my God, I can't go any further. I have to rest for a minute." It's not that your legs won't carry you, it's that your breath is not providing the resource, the energy, the oxygen that you need to move forward. And your heart starts punching onto your chest, and a combination of two. And you say, I walk all the time. But now you're walking up the set of stairs. It could be a sign of anemia. It could be a sign of pulmonary disease. Yeah, it could be a sign that you're smoking too damn much and you got to get rid of those cigarettes. But it could be a combination of things. You can't ignore it. That's not normal physiology. If you walk up your stairs at your house from downstairs in your living room, upstairs in your bedroom, and it hurts to walk upstairs, meaning you're short of breath, or even your legs are cramping and so forth, it can also be one of those things. And you're walking slowly, right? And you're short of breath. How about your bowels change? It's one of those things that nobody likes to even talk to their doctor about it. Say, doc, I have this bowel problem. I have this, and then they dance around the circle on it. But all of a sudden you've been regular forever, and all of a sudden now you're blocked up, you can't go, and it hurts, and the abdominal area is tight, and you have to do all kinds of catharsis to get things to go. And what do I mean by that? You're going to the store, you're buying these laxatives, you're buying these stool softeners. That can simply be not enough water in your system. And how many of you really get, and on average, 8 ounces of water at least 7 times a day to 8 times a day? And that's probably less than what some of you should have. But you're dehydrated, and your body is getting caked, and your stool is getting hard like cement, and you're not getting rid of the lymphatic tissue, drainage systems the way that you should. So all that poison is building up in your body, and you're becoming much more irregular, if you will. Or it could simply be, do you have blood when you get up? Say, oh, there's just a couple of drops of blood. Well, my friends, that could be one of the primary indicators of that you have cancer. And if it's red blood, real, bright red blood, it could be that you have a fissure, it's a little tearing of the sphincter in your anal area, or it could be a hemorrhoid that's very low. But if it's a brownish color, if that blood is dark, don't hesitate. Go get it checked out now. And those of you say, well, I don't want to get a colonoscopy. I don't want, that's dangerous and so forth. Well, there's a lot of other things that you can do. There's poop and scoop, and send it to the lab. They identify about 95% of all cancers. It's a way of doing it. So if you're like me, that's what I do. And I get that squared away. And, you have to look at the symptoms and the signs. Is it necessary for everybody to get a full-blown colonoscopy every few years? Not necessarily. And in most cases, not so. Unless you have a family history, multiple history of colon cancer, unless you know that you've been putting off trouble for a long time. Maybe one, And if that comes back the way it's supposed to be, you're good to go. And then you do the poop and scoop as we talked about. But you have to pay attention. You can't ignore it because it costs you your life. And, we want to be around for a period of time, right? How about people who are confused? You're never like that. My mind was totally sharp. I was able to comprehend and appreciate anything. All I had to do is hear it one time, and I was good to go. And now you can't remember squat. It can be a lot of reasons. In today's world, and we're seeing it, post COVID, the viral patterns in which we know all viruses can cause changes in neurological function, and particularly the body's ability to think through processes. So if that's the case, and that things are different, it could be the exposure to heavy metals. Some of you have lived in areas where there's high levels of mercuric oxide in the air, which is the worst type of mercury exposure. Where does that come from? That comes from coal burning areas. And, things like Pittsburgh, Pennsylvania, and Buffalo, New York, and out in Ohio. And, I asked that question, particularly some of us are, in my age group. And I say, hey, listen, where did you grow up? Where'd you live? They look at me quizzically. They say, why? Why do you want to know that? And then I explain the process. So, Bethlehem Steel used to use coal burning fires to melt the steel, the ore, to make steel. But the side effect of that was mercuric oxide. And so Buffalo, New York had one of the highest rates of all types of cancers across the board forever. Knowing that, they built this place called Roswell Park Memorial Hospital, which was a cancer research institute. Why there? Well, a lot of reasons. They had that. And then there's another piece. They had toxic waste sites embedded in the artesian water system of Western New York. I think at one point there was like 15 of them. And so you have all this toxic waste breaking through their containers, going into the water, and the people are drinking that. And then you had low levels of vitamin D in that area. Why? Because it had the greatest amount of cloud cover of any place in the United States. So when you put all that together, you better ask the question of the patient, because something's showing up that's not normal. Got it? So let's walk through that process. So what happens if you eat and all of a sudden you feel bloated? Every time that you eat, particularly at nighttime, and you're distended, you're bloated, your body's not working the way. What could that be? That could be a suggestion that you have a gallbladder problem. Now, do you have to have the gallbladder taken out? The absolute answer is no. There's ways of handling that to soften the bile. Remember, the bile is not made in the gallbladder. It's just stored there. It's made in the liver. So it's telling you that your liver's not working the way it's supposed to either. And that could predispose and lead to things like gout and the uric acid that builds up. They're like glass shards. They can cut you up pretty good. So there's a lot of things you have to pay attention to. How about flashes of light? All of a sudden, on the side of your eye, you see what looks like this, the Venetian blind curtain down. That's your retina that could be detaching, and you better go get yourself checked out like yesterday, because you don't want to lose your eyesight, right? So you have to pay attention. Say, well, let me see if it'll go away. No, you pick up the phone, you call the doctor, and you go get it checked out. Now, we're not talking about fixes. We're going to do that on Wednesday night, the 19th. We're going to show you how to fix some of these things. How about damage to your teeth? The old choppers there. What happens if you notice that you're wearing them flat? It's because you're grinding at nighttime. What's one of the symptoms what's one of the causes of that symptom called grinding? It could be parasites. It could be a whole bunch of stuff, because then you grind at night in your sleep, particularly children, by the way. If you have a child who's grinding their teeth all the time, it could very much be a parasitic infection. And you have to treat it, because it's going to affect neurological tissue, it can affect the body systems throughout. Find it, fix it, leave it alone. So understand that body signs and signals are not things that you ignore and say, well, take a couple of aspirin and call me in the morning. The subtle signs are so important. And you have to really understand what they are and what happens. You have eyes that are super dry all the time. That could be fatty acid metabolism. And, we deal with patients with that all the time. It could be allergy reactions. It could be something called Sjogren's syndrome. Sjogren's is an autoimmune condition, and it causes inflammatory reactions. And one of the primary presentations is dry eyes. And so you have to understand that there's very specific things that are related. So what do you do with that? Do you go take the steroids? You get the immune suppressors, we call them biologics, or do you actually go after the underlying triggering mechanisms, which usually is toxic environment and stress patterns? I have a patient who's now somebody who works for me, who came in many, many years ago with very advanced Sjogren's with Zika pattern. And what happened was that this woman was told she was going to die, because that's something that Sjogren's can do to you as it starts shutting down body systems. So they wanted to put her on every medication you could possibly think of. She came in actually looking like she was back and forth to the pharmacy all the time. So what we did is we began to support adrenal function. We began to get the neurological system to work and communicate properly. We got the immune system to balance the way it's supposed to. And short end of a long story, she was under care for about 3 years, but off of all her medications, doing extremely well. And she got her life back. And she continued the process of tweaking and tweaking and tweaking and tweaking. Now, so the inflammatory reaction within those tear producing glands in the eyes are what's affected. And it's because of that inflammatory reaction that you get that dry eye presentation. What happens if you have white patches inside your mouth? Okay, what are they called? They're called leukoplakia. And it's a big word that just means the white patches. And it could be the beginning stages of cancers of the mouth. And so you can't ignore them, but they're really very specific in how they present themselves. And you can have a white tongue, that's candida, that's mold and fungus coming from your gut. But these little white spots on your tongue, if they're leukoplakia, you got to check it out. Could be the beginning signs of cancer. So how about you're always cold? Your hands are cold, your feet are cold, no matter what you do. You always need a blanket, you're always warming up. In our world, what we're going to look at is something called your HPA axis, hypothalamus, pituitary, adrenal. And it's not okay when that shows up. You have to find out if there's a problem with that. But here's the other piece. It could be an indicator of heart disease. Cold all the time is a result of things slowing down, your body's burning less energy, and it could be finger pointing that the mitochondria, the little engines inside your heart, your brain, may not be working, and they're beginning to show that you may have a heart problem. You need to get that checked out and see what the situation is. How about have you ever not dreamt, and then all of a sudden you start having really, really intense dreams? It's one of the finger pointings towards Parkinson's. But again, it's not somebody that dreams all the time. It's somebody who doesn't dream and doesn't have these vivid dreams or nightmares, but all of a sudden they start again. But it's one of the signs and symptoms of Parkinson's. So you have to be able to look at that and be able to rule that out. We'll go back to the coldness, Raynaud's, right? Your fingers and your hands and your feet, they turn blue, even when there's a mild change in the weather. What I would encourage you to do is get a hold of thermography centers at Fairfax and have them do a thermographic image to see if that's it. It's the fastest way of diagnosing it, because it'll show up. Remember, thermographic imaging is a recording of heat signals in the body. And they'll look at your hands and your feet, and if there's no color there, it looks blue or even black, that's a positive, almost absolute indicator of a Raynaud's problem, a Raynaud's disease. According to Mayo Clinic, they talk about Raynaud's as alteration in arterial flow. And it's straight up, that's what it is. The underlying question is, why did it happen to you? And it's a parasympathetic, sympathetic problem. Sympathetic is fight, flight. Parasympathetic is a healing process. It has to be in balance. And there's a lot of reasons for that we need to look at. How about if you're always kind of goofy, meaning you're always spaced out, right? You're feeling tired, you're forgetful, that spacey feeling. It could be something very simple. It could be low blood sugar. It could be hypothyroidism too. And you've got to be able to get that. If it's an underactive hypothyroid, it's just not a matter of putting medication into the system. It's a matter of understanding why the thyroid is not functioning properly. And unfortunately, my experience teaching around the globe, that most docs really don't get it. Some do, but some don't. You have to start looking at the nutritional components and the neurological components and the energetic components of all that interaction. Remember, the thyroid is provoked to work by the pituitary by releasing something called TSH, thyroid stimulating hormone. Now, that works nicely, providing that there's not a veil inflammation obstructing that signal, and that there should be something called tyrosine, iodine, and selenium, trace minerals, available so it can produce something called T4, which is thyroxine, which is the primary active hormone, has to be converted then into the one that actually works, which is T3. But that's something that we talk about in other subjects as well. But you have to pay attention to what that means and so forth. We talked a little bit about bloating. How about if uh, your hair starts falling out and you always had a good head of hair? Well, you need to look at a couple things. You can look at dermatological problems. You can get little things that kind of choke off the hair follicles, but it can also be genetics. And if it's that, chase your tail, spend your money, but that's the way it is. See this thing on here? That's genetics. I didn't know that until I found a cousin that was my grandmother's cousin's son, and he looks just like me. And I said, oh, okay, that's where it comes from. It wasn't something else. It wasn't my thyroid. It wasn't anything of that nature. But it could also be problems with your thyroid. It could also be zinc problems. It could also be an infection. It could be a lot of different things that can be remedied. But, take a look at your family. If you look like, and it's on your mother's side of the family, by the way, if you look like people on that side of the family, then guess what? That's nothing you're going to do much about unless you want to go plugs and implants and things of that nature. I don't know about you. I kind of like my head. I like the way it is. I'm not going to worry about it. And you go from there. You have these moles and these strange looking freckles, if you will, on your skin. You got to watch them, because if they begin to break down, they can form a very deadly skin cancer called, a myeloma, if you will, or melanoma. And excuse me, and it's a problem. It can cause you your life. It can kill you. It can take you out. There's ways of dealing with those things. Anyway, on the 19th, we're going to get into detail on so many different aspects of these signs and signals. We're going to show you exactly, what they mean, what they're talking about, but more importantly, what you can do about it and how you can fix it. Just because you have these things going on doesn't mean that, oh my God, oh my God, oh my God. Always look for the horses, not the zebras, when you hear the hoofbeats, meaning the signs and signals that something is not working the way it's supposed to. If you start forgetting how to do things that you did very well, if you start a process of you don't know where you put something, but it's on a regular basis, not just because you're tired, the combination of those things could be a signal that there's something more problematic going on. And what could that be? That could be Alzheimer's. It could be old age dementia. If you can catch these things, in my experience, and what science is starting to show now, is that you can reverse these processes. We all know that with our Parkinson's patients, the amyloid plaque that builds up and starts breaking down the signaling tract into the lower portion of your brain is the culprit. Where did it come from? There's a lot of indicators that suggest that things like the heavy metals, mercury and aluminum and things of that nature. But there's also other indicators that suggest that trauma that's embedded within the system and causing the brain to shrink can also be problematic if it's not dealt with properly. So we want to make sure that we have the ability. What happens if you lose your smell? Is that a problem? Well, it could be, a problem. It could be an early sign of Parkinson's. It could simply be that, You had a virus like in COVID. One of the signs of COVID was what? We lost the smell and lost the taste. And there's ways of reversing that. But could it be serious or could it be minor? Most of that stuff was, with the implementation of things like zinc and other elements at high levels, reversed it very rapidly, very quickly. It came back. How about if you bruise easily and you're not on any blood thinners? Could be a problem, right? It could be a liver problem. When you bruise and there's no other reason for it, and it's not because of blood thinners or things that are happening vascularly, you got to take a look at the liver. It could be serious, significant situation, and you can't ignore it. So as you see, there's so many different indicators that you can't ignore. And we're going to cover a ton of them on the 19th, but we're going to give you a way to fix them. We're going to show you what to do about them. As always, if you have any questions whatsoever, you can get a hold of me by simply going to drtomroselle.com and, let me know. I'll get a hold of you and say, hey, listen, this is what we need to do for you, or this is what you should suggest. Or if you need a referral outside of our area, we can do that as well. We're here for you on an ongoing basis. I want to remind you something that I tell people on WMAL 105.9 FM all the time. And most of you have heard it here as well. We're in concert with a charity called Caring for Others. It goes back to 1998, 1999, and they help people who have nothing. They give scholarships to people who, are going to healthcare schools like chiropractic and acupuncture and naturopathic medicine and nutrition and so forth. One of the greatest delights that I have is working with these kids who have been found homeless and have nothing, and mothers and children as well. But here's the deal. We donate our time and our resources to help them facilitate their mission. And so we're able to donate our time to do that by doing public service events. If you have a church, if you have a club, if you have an organization that you would like one of our doctors to come out to and present a lecture on anything: nutrition, cardiovascular disease, back pain, sciatica, migraine headaches, just autoimmune conditions, to name a few. We'll focus on what it is that you want to know more about. All you have to do is get a hold of Sybil McFarland at the Roselle Center, or you can do it through drtomroselle.com and just send her a note, say, hey, can you reach me? And she'll reach out to you and we'll get it done. But I promise you that we'll do it happily, because this is why we're here, to help as many people as we possibly can. So the 19th coming up, this coming Wednesday evening, 6 p.m. at the Roselle Center for Healing. But please register and do it right now. Do it today. Make sure that we have a seat for you. I don't want you sitting in the hallway. I want you sitting there comfortably, listening, having fun with all of us and so forth. So we'll make it happen. As always, I'm going to try to keep it interesting for you. I'm going to try to continue the process of giving you more and more data. Why? Because you need the information. You need to be the master of your own health. Remember, Asia's Health, my book, Health is a Do-It-Yourself program. That's why. But more importantly, and the reason I continue to do what I do, I love you all. You have a great day. We'll see you soon.